Hello, I'm Dr. Ruth Roberts. I hope y'all are well. And many of you were asking about calcium, and you are all freaked out, convinced that there is not enough calcium in the CrockPet diet. And believe me, I understand why you are confused, because it is confusing as hell for me to wrap my head around. Now, Lolly did some awesome research, and Lolly, if it's okay, I'm going to share a couple of examples of what you found, because I think it illustrates extremely well why it's so damn confusing. So to start with, what I'm going to show you is the nutritional analysis of the CrockPet diet. So this is the sheet that I got back from the boarded nutritionist, and the reason I'm not telling you his name is because he is working for a university and then, interestingly enough, went off and started his own home-cooked diet. So at any rate, let me move this out of here. The other thing I want you guys to understand, actually what I probably ought to show you first, is this. This is the NRC nutritional requirements for adult dogs at maintenance. And here is why this is so bloody confusing. Nutritional requirements for dogs and cats are calculated on kilocalories, the amount per 1,000 kilocalories, not on how much does this 10-pound dog need, how much does this 15-pound cat need. So it is based on what they eat, and why they decided to do this, I don't know. The other thing I'm going to put out there is that it is recommended to feed your pet something like 25 to 30 calories per pound per day. And most dogs can't eat that without getting fat. And realize that that recommendation comes from looking at beagles in a laboratory setting. Beagles love to eat. They're also an extremely stressed out situation. And so then what do? Okay, so here's the NRC requirements. And by the way, y'all, as I said earlier, I'm in the middle of reformulating holistic total body support. And so some of these things, you will see some of the nutrients change based on different recommendations. So here's the amino acids. You will note taurine is not in there. And this is because dogs are supposed to be able to manufacture taurine on their own if they have an adequate supply of the other amino acids. The ones that you see here are considered to be either essential amino acids, meaning that the animal must consume them, or they will not have enough nutrition. And then from these amino acids, they can manufacture the other one. I think there's something like 29 of them altogether. Now, so there's fat. Here's linoleic acid, which was a question a bit ago. And you'll notice there's no minimums or maximums. But here's the recommended allowance per 1,000 calories. And then same thing with the omega-3 fatty acids here. And then here's our friend calcium. And the recommendation is somewhere between 0.5 gram with no maximum. The minimum amount is 0.5 gram per 1,000 calories. The recommended amount is 1. The phosphorus, this is just really bizarre, right? Minimum, maximum, and yet they say 0.75 milligram is the recommended amount. How does that make sense? Well, that's about the right ratio over the years of calcium to phosphorus, 1 to 0.8 roughly. So this is the thing. We really have very sketchy information about what we should be feeding our pets in terms of supplements. So I will, and thanks for letting me kind of use your stuff here, because I think this will go a long way to helping y'all out. I'm going to put this up in the group so that you'll have access to this one. And this was just a nice summary in Merck, just because it's in tabular form, and otherwise it takes a while to read it. So I'll put this one and the cat one up in the group after we finish. Now, here is the analysis of the CrockPet diet. And I think I have put this up in the past, but I can't remember, so I'll put them up again, both for the dog and the cat. So, again, here's our confusing. So this is roughly how many calories are in one batch of food. Is about 2,000, and that's over, something like 16, I think we decided 14 cups was the amount we would use. And so there you go. So there's our protein, which you can see is higher than the normal recommended, fat, which is higher than recommended, and then carbohydrates, which they don't put a percentage on, but you can bet, and it is confusing, but you can bet that, so this ratio is in roughly 1/3, a little heavier on fat, a little lighter on carbs. Most commercial diets are going to be somewhere around 22% protein, 15 to 25% fat, depending on what you're feeding, and then the balance in carbohydrates. And this gets so dang confusing. So here's vitamin A. And so this is the recipe itself without the addition of anything else. Here's all the B vitamins, which we're exceeding, which I think is a good idea. Vitamin D is a big controversy. So April's asking, what are the two right columns? So here's the per serving, and then here's the recommended amount based on the NRC recommendations. So we're taking, and why this doesn't come up to 2,000, I don't know, but that's what the Dude software did. And then this is the percent of the actual fed compared to the recommendations. Does that make sense? So again, protein according to NRC is in excess, fat is in excess, calories, who knows, because they don't make a recommendation, or carbohydrate calories, who knows, because they don't make a recommendation. You'll also note that they do not have any recommendations for fiber, and then breaking these fats down into what should we do? Should we put in more monosaturated fats, polyunsaturated fats, or saturated fats? And that's a whole nother topic. So, and then here's the vitamin recommendation. Here's these are what are in the diet compared to the NRC. Because of the exacerbated skin stuff going on all over the place, I think higher vitamin A is a good thing. It's been shown that it is actually profoundly difficult to become toxic to vitamin A, if that makes any sense to you. And so I'm talking doses of 300,000 IUs of vitamin A. And so a regular over-the-counter supplement at the drugstore is about 8,000 IU or 2,400 milligram. To become toxic on vitamin A, you have to eat 300,000 international units daily for 6 weeks. So that's a ton, and you'd have to really work at it. So April, this is based on the original recipe with all three of them. And I've since used nutritional software, which is in the recipes, that's what you're seeing is the printout from that nutritional calculator to make sure that these values are in the same. The company was able to help me upload the NRC values per 1,000 calories. So this is generalizations. And let me kind of go through some of this because it's going to get a little bit more confusing. So there's all your B's, there's all of that good stuff. Now, here's the actual amount of calcium fed in the diet without any supplementation, and here's the phosphorus. These are pretty close because we're feeding more protein than what most NRC people think is appropriate. And then, there's all the rest of it as far as sodium, magnesium, iron, that kind of thing. Now, as I mentioned earlier, some of you have breeds where iron storage disease or copper storage disease can be a problem. So excess iron can be a problem if you're feeding a food with food colors in it, even if they're natural. The values in the food often far exceed this. The nutritionist felt that this level was not a concern. Now, if we go down here to iodine, we're about slap on. Zinc, we're about slap on. Copper, we're a little bit low, but I think that's probably not awful. And then chromium, manganese, selenium, all of that good stuff. And then omega fatty acids, linoleic acids, how much is in, omega-6 fatty acids. I don't know why they put this as a nutritional requirement. So anyway, that's what it is. When you feed conventionally made proteins, this is the ratio between omega-6 and omega-3. And this is why I encourage you to feed lean cuts of protein and add fats back in. And if you are able to afford to feed grass-fed, pasture-raised animals, this ratio reverses, and it goes back to either equal or slightly higher on the omega-3 fatty acids. Again, omega-6s, pro-inflammatory, omega-3s, anti-inflammatory. And then here's our amino acid profile. If we come down, and this is so weird. So again, this is for a dog. Because they are able to have more than sufficient amounts of all these other amino acids, theoretically they should be able to make taurine. So that's where things got kind of mucky with the grain-free diets. Now, as some of you have probably seen, and again, I'll reload these and hopefully this will make more sense, there are some nutrients that are insufficient. So choline's one of them. And there's questions about, do we really need choline? Do we not? And again, the omega-3 fatty acids. Now, let me pop one more thing up here. If I'm smart enough, here we go. All right, so this is, again, I was starting to do some work on reformulating the holistic total body support. If you pull up the label in the shop, this is the profile you're going to see here. So again, the things that are a little low, and again, I may be reformulating the iron down somewhat, are made up here. So this is where you've got 75 milligrams of calcium per quarter teaspoon of holistic total body support, which is what's good for up to 20 pounds. And then if we go down here a little further, here's the choline, so again, some reformulation is coming. And then there's the organ contents as far as milligrams per dose. So super confusing. Basically, what I'm trying to get over to y'all is that the diet in and of itself is damn close on a per 1,000 calorie basis. So there's some things that needed help, and that's what's included in holistic total body support to kind of bump it up a smidge. And the calcium level that's in this diet reflects and actually this was the deal, that's how much was going in to start with, and now there's 2,000 milligrams of calcium being added to each batch of food, and so that takes it up to the NRC guidelines. Is this making sense so far? I hope so, because wow. And I have been reading through Dr. Dodds' book on canine nutrigenomics. She uses the NRC guideline for calcium. And then Lolly did a ton of research, and bless your heart, Lolly, because you did great stuff and, came up with a lot of information. So I'm going to share a little piece of Lolly's email here. And she wasn't panicked until she read the article where it says the blood tests with normal levels mean nothing. And that's not quite true, but there is some truth in it. And there's some questions from somebody that has a dog with primary hyperparathyroidism. And so if you're really concerned whether your pet's blood calcium is normal or not normal, that's when an ionized calcium test is reasonable. So, one of the things Lolly said, okay, last but not least, here's a sample from Dr. Pitcairn's, and it's almost like the CrockPet diet with 3 pounds of ground turkey. Well, it sort of is, except for this one thing. He says, feed a cup of cooked vegetables or less, or can omit it periodically. And this is the calorie makeup here. 5 cups of raw rolled oats. All right, so now we're back to a commercial diet where we've got over 85%, 65%. I'm trying to read comments and do this, and my brain doesn't quite go there. So where you've got over 65% of the diet being carbs. And so that's part of why he's having to add so much bone meal. And I think that this would be, and I'm not sure what the total calories are here, but this is why he's adding a ton of calcium. Now, I used to use Dr. Pitcairn's stuff for cats, and I induced struvite crystals because there was an excess amount of calcium in the powder. So there you go. That's one thing. Now, some other stuff that Lolly sent over was a link, and this is where it gets confusing, even more confusing. So this is a booklet provided by the NRC, the National Research Council. And they go through some nice stuff and this and that and who wrote it and what it's all about. And so what I'm going to do, and this is where it gets more confusing, is they don't make this super clear that this is on a 1,000 calorie basis. They sort of talk about it here. So if you feed a dog a 1 pound can of food per day, that's about 1,000 calories, basically, is what they're trying to get back to. So and I'll put links for this as well, because it is really mind-boggling. So here's how many calories per day, and you'll notice for the inactive dogs, we're at, that's 30 roughly calories per pound. For adult active dogs, they're cranking that up to almost 40 calories per pound. Pregnant dogs and puppies, that's a whole nother bag of wax. Older active dogs, more calories. Well, I'm so sorry, but this is going to make most pets fat. And this is why so many of you see your pets lose weight on CrockPet Diet, because it doesn't have that high carbohydrate concentration. So this is the idea, and 1 kilocalorie equals 1,000 calories. So let's go down to, and this has got some good info in it, and now we start to get into the actual nutrients. So here's what the energy needs of lactating dogs, and then we get into this stuff. The thing that is, again, confusing is if you read through here, it's not saying clearly that these are recommended allowances, I think, until you get somewhere down to the bottom where the asterisk is, that these are per 1,000 calories. And this is really confusing. So if you, the pet owner, and actually I looked at this and was like, what the heck, man? Looks at this is telling you that your dog, whether it's 10 pounds or 100, needs 1 gram of calcium per day. Well, that doesn't make sense either, does it? And here's phosphorus at that 0.75 grams, and so on and so forth. So essentially, those are going to be the recommendations that I just showed you. And I'm sorry, I can't see from here who made the comment about, while we're figuring out nutrients, etc., can we make sure that the the recipes are up to date, and indeed they are. They are balanced through nutritional software against NRC guidelines for dogs and cats. So that part you can kind of take off your mind of worry. Now, let me show you a couple of other things. This was an article that Lolly sent over from Whole Dog Journal. And so calcium in homemade dog food, are you doing the right amount? There's so many, and she's correct in saying that most of the home-cooked recipes out there don't have enough calcium in them, and they are not balanced. Now, here's the other thing that's interesting to me. So she says in this paragraph, the NRC says 1 gram per 1,000 kilocalories. And then the AAFCO officials said, okay, in 2016, actually they didn't reflect, they said a higher number, 1.25 milligrams of calcium. And this is because their manufacturers want to put in, stuff, bone, a meat meal, which may include bones, which is going to kick your calcium level. So this value of 1.25 milligrams per kilocalorie per 1,000 calories means that they stay in bounds without actually having to change everything. AAFCO also says that the copper levels at 7x, what's considered safe, are okay as well, so that the coloring agents can continue to be used. So now what this woman has done is use, instead of the NRC amount, she's used this 1.25 milligrams per kcal and used that in her table to say, okay, if your dog weighs 10 pounds, then it needs 350 milligrams of calcium. Okay, so I can't agree with this. I think that's too high, and I'm going to backtrack to that in a minute as well. And I think that's all the bits and pieces here. So what I wanted to do now is show you that with the CrockPet Diet being at, my brain hurts, does yours? So with the CrockPet Diet being at 2,000 milligrams per batch, that is at NRC levels. Now, when you feed holistic total body support, you're going to, and this is Becky, this is why you guys are getting freaked out, because at first glance it doesn't look like it, right? So with Dr. Pitcairn's diet, he doesn't include very many vegetables, and there is a ton of calcium and minerals in dark leafy greens, right? And what's a good chunk of the CrockPet diet? Dark leafy greens, brassica species, things like that. Anything that's green has got calcium and other minerals in it. So you are actually at NRC levels for CrockPet Diet. If you feed that and nothing else, you have sufficient calcium. Because many of you cannot feed the recommended caloric intake per day, this is why I recommend using holistic total body support, because each 20-pound dose includes an additional 75 milligrams of calcium. So if you'll pardon me, I kind of did some, if I can find this dang sheet, I did some calculations for Lolly, and so she was, what I can tell you is that between what you're adding in terms of calcium to the food when you make it and what you're giving in holistic total body support, for a 10-pound dog, that is 200 milligrams. And because there's already more calcium in the food itself, there's your other 50 milligrams. So I hope that makes some sense. And April, if you are really, really worried, you can indeed get an ionized calcium test done. You can also go back and look at, okay, how many cups of food am I feeding? And so how many milligrams is in the food itself, how many milligrams is in the supplement that I'm giving, and see if you think you need to bring it up. So this is the other thing that is super confusing, is that now, okay, we've got to work our way into what's the appropriate amount in for a 50-pound dog. And so if we say 25 calories per pound of body weight is what we should be feeding every day. This is where my brain really hurts. So that's 250 times 5, so that's 1,250 calories a day, which is about half a batch, or 7 cups. Now, most of you guys, even Esau didn't eat that much. So this is where using some sort of a supplement works. The other thing that I learned when I was creating this diet is that it's not so much how much calcium does the dog need, it's how do we keep that calcium-phosphorus ratio in balance and make sure that the dog gets enough, or the cat for that matter, but go from there. But I got to tell you that all the ionized calciums I ran in practice were normal, with the exception of the dogs that truly did have primary hyperparathyroidism. Now, here's one other thing I want you to consider, and I can't get to the comments until I can't get to the comments until so Lolly, your pup was, so there you go. So there's 4 cups a day. That's brain damage. Anyway, you're damn close between what you're adding with the supplement. And I'll put a link to this little article in your and guys, I'm going to work on how do you figure this out, because it is so bloody confusing. If my dog is eating X, how much more do I need to use supplementation wise? Now, I want to put this out here in terms of the danger of looking at a single nutrient in exclusion of everything else. So ladies, for years we have been told to take calcium, right? 1 gram a day, because it's good for our bone health, right? Are you guys still doing that, or no? Then, the calcium's not being absorbed because you're vitamin D deficient. So you have to take calcium with vitamin D now. And this is why it's so hard to find a calcium supplement to add to the CrockPet diet that does not have vitamin D in it. Well, golly, actually there's this study that says that if you take calcium in excess of what you need, even if you take it with vitamin D, your chances of having a heart attack actually go up tremendously. Because guess what happens to the calcium? If you have little plaques or little deposits of fat on your artery walls, the excess calcium goes there and makes those things little rocks that are not letting go of the side of your vessel. And so if you are pro-inflammatory, all of those pro-inflammatory molecules get wedged. So here's this little plaque against your artery wall. The little pro-inflammatory molecules get wedged in here, and they piss off this artery wall, the artery wall. It constricts and closes off, and then you have no blood flow through the artery, and they're in your coronary arteries. When that happens, that's when you have a heart attack. So, wow, holy smokes, is that confusing, right? So this is, again, that whole message of looking at things in balance. And are there times when higher doses of specific nutrients are useful? Yes. So Becky's saying she's in the Pacific Northwest because she rarely sees the sun, and so she takes vitamin D supplements now. Well, now there's articles coming out saying that maybe they're actually not that helpful. And I think there's a lot, they're going back and forth on this, and they don't know. Is vitamin D going to be harmful? No. At those doses at 10,000 IU per day, which is what many doctors are recommending now, no, they're not going to be harmful. Again, we've been told you can become toxic on vitamin D. It takes a lot to get there. Vitamin E and selenium are the only two that you have to really be super careful about, because you can reach toxic levels via supplementation. And for dogs, excess copper is an issue, and iron as well. So I hope that makes some sense. It is super confusing. There is so much going on out there. And because medicine, doctors, and I wasn't either, I was never taught about nutrition other than what I think Hills owned the textbook when I was in school. I think it's been changed since then. But I mean, it's now Hills or IAMS or Royal Canin, whoever makes the script diets anymore. I think Hills and Royal Canin are the two big ones now, are training veterinarians in school to feed their food, and we're drinking the Kool-Aid because we get the free food for our dogs, right? So this is our education in nutrition, and frankly, beef cattle and dairy cattle have a much better handle on nutritional supplementation based on how the animal is going to best perform on the feedlot. But the goal of beef cattle is to get them big and beefy quickly. And so optimizing nutrition becomes profoundly important. It's not important to us in small animal medicine because most of us still don't have that concept that this creates disease when we are malnutritioned, either in a surfeit of excess calories or just bare minimum amounts of essential nutrients. Whew, that was hard. Are y'all confused too, or is that making it a little bit more clear? So there's several things I'm going to be doing over the next few weeks. One is figuring out, okay, if you can't feed the caloric recommendations, and I think probably a more accurate number particularly for large to extra large dogs, is going to be somewhere around the 18 calories per day. For smaller breeds, it just depends. If you're sitting there bordering on hypothyroidism and you're like Mona, who would love to eat the recommended daily allowance, but then her belly would only be that far from the floor, this is where we've got to really make some changes. And if we treat the food, the supplementation, like that's all that needs to be supplemented, what do we do? So in May, that's really interesting. It's not sun. The other thing that's interesting about sun exposure that most people don't realize in terms of vitamin D, this is why we're all vitamin D deficient, because we bathe at least once a day. When the sun hits your skin and makes vitamin D, it takes you 12 hours to absorb it. So use less soap. Yeah, that's the ticket. I mean, and that freaks people out too, but that's why we're vitamin D deficient, because we are over cleansing ourselves, so to speak. The way I kind of combated it, and this horrifies most MDs because it's like, oh my God, you're going to get skin cancer. Well, it turns out that the sunblock probably caused the skin cancer. So what I do is go outside and lay in the sun for 15 minutes on the front till I feel my skin tingle, and then lay on my back and for another 15 minutes and then come in. Now, I've been in the sun almost all summer, and I do wear a hat, but I don't wear sunscreen, and I don't wear sleeves and stuff to protect it. And I'm pretty dang fair-skinned, right? But I've got a tan, but I never burned this summer using that technique. And so, it's all about making sense. And it turns out that the PABA and some other ingredients in the sunscreen were predisposing people to malignant melanoma. And that's why so many people that rarely see the sun are showing up with malignant melanomas in places literally where the sun is not shining on them, because they've gone outside all covered up, and then bam, here's this big ass tumor on their backs where they haven't seen sun in decades, since they were kids periodically. So this is the frustrating thing, is we seize on this new miracle thing, like spirulina. That was the amazing wonder thing for a while. Oh, well, maybe it's not such a great idea. Remember blue-green algae probably 20 years ago, how that was a big thing? And that came from the pure waters of the Klamath Lake. Well, we went down to Klamath Lake last year, July, first big rest stop on our trip. And we got there, we were so excited. Mary Jo had booked a house that was right on the lake. We could watch the grebes, we could swim. We're hot, it's nasty, it's 95 degrees, and we walk out and the water is green because the blue-green algae have gone bananas with the heat, and they actually, if you swim in that stuff, you will slaughter your liver because they're actually producing toxic materials in response to the heat. And y'all, believe me, it is profoundly confusing. And if something is not making sense to you, this is what this time is for. So my brain has more capacity than it used to, but it is so confusing. And I think that there is not a good way for you as a consumer to understand it, because I just showed you 5 different examples of what people think should be done with calcium, or 3 anyhow. And I think 1 is downright dangerous, and the diet is imbalanced. And the other is, well, I like this number better because it makes more sense to me. So this is the thing. We really don't have good research on nutrition in dogs and cats. The NRC is the organization I tend to trust more than AAFCO. And long time ago, NRC and AAFCO were the same thing. And then AAFCO would take the NRC recommendations and use them and blah blah blah. Well, all of a sudden the pet food companies were the ones controlling AAFCO, and so they use the NRC requirements when it suits their purposes. But for the vast majority of the time, NRC is a much more reliable source of data. But it is still profoundly confusing because they're telling you this based on calories per day. And when I formulated the CrockPet diet, I talked with the nutritionist about this, and he's like, yeah, nobody really talks about that, but a lot of us feel that you probably do need a supplement if you can't feed the number of calories per day that's recommended. So, that's freaking pathetic. Yeah, they're probably undernourished. So yeah, it's probably a good idea. But these are the people that are telling me that I'm a charlatan because I'm not following their recommended macronutrient profiles. And yet, many of you have been given this home-cooked diet from, in fact, Lolly, the one that your dermatologist gave you was mostly rice, I think. Anyway, that's the soapbox. I got a couple of questions to answer for you. Yeah, exactly. Before we started trying to balance it. And basically what we're trying to do is balance back out of an improper ratio of nutrients, macronutrients, right? So macronutrients, protein, fat, carbs, micronutrients, vitamins, minerals, omega-3 fatty acids, other fatty acids. Yeah. All right. So, and Lolly, it didn't make sense to you, did it? So there we go. Jennifer's asking, thanks. And what do I do with my baby boy that's been diagnosed with prostate cancer and given 6 to 9 months with chemotherapy? So I don't plan on adding carbs. So I think keto's reasonable. Jennifer, first thing I would encourage you to do is, if your dog has ever had pancreatitis, is to go slow. Don't go from conventional 65% carbohydrate to 5 to 10% carb, because you will probably induce pancreatitis. So go with the cooked version first. And yes, as far as oil goes, add that after the batch has cooked. And then again, rotation. So all of the vegetables you mentioned are great. Just don't use them all the time, because they contain all these miracle nutrients. That's where targeting nutrition is very important. And again, happy to do a consultation. I would love to keep doing that work with y'all. So I hope that's helpful. There's a ton, and I will be reshooting a making the CrockPet video making the CrockPet Diet video this week, I realized, oh my God, that thing is 2013. So what's that? 6 years old now. So things have changed quite a bit. So we'll bring it up to date. Kathy, dewormer routine versus not doing routinely. So first thing, and I think you're probably on a plane by now back to Morocco, but you can watch this later. So the first thing is what's your dog's exposure risk to parasites? If your vet is recommending deworming every 3 months, this is a CDC recommendation. Does it make sense? Sometimes it does, sometimes it doesn't. If your pet has big exposure risk, they're hunting, they're out working cattle, horses, things like that, maybe it works. Maybe it makes sense. If they're sitting in your yard all the time with no exposure to other dogs, things of that nature, probably not so much. If they've never had worms, probably not so much. If you're using an Interceptor or Sentinel as a monthly heartworm pill, you are deworming for whips theoretically on a monthly basis. If he's concerned about worms, to be honest with you, I've not had great success using herbal dewormers because the volume you have to use and their bitterness tends to make them unpalatable. So when you get back home, think about this. How much are my dogs at risk? And what are the exposures here where I'm living? So I hope that helps. And I'm sorry I missed. Oh, I can't remember who this was that had the question about primary. I think it's primary hyperparathyroidism. So this is where an ionized calcium test is what's going to get done. And I think Anne, that's who it is. No, that's not right. Crikey. Denise, not eating well, things like that. If her calcium is super high and you're going to the vet today, please ask them to put her on prednisone because it will bring the calcium level down and she will feel better. So just please, I mean, this is where prednisone is a good thing. It buys you some time so your dog doesn't feel like dog meat until you get a diagnosis done. And it is a concern, and this can be associated with kidney failure and other things. And Denise, again, that's when you get some answers. I would love to help you with kind of working things with supplements and things of that nature. And let's see, Sita, that's your lovely batch. And then Anne posted some pictures on Max with some random patches. And frankly, Anne, what those looked like are skin infection. And so what happens is they get crusties underneath there, it blows out, and the hair and the scab falls out. So there is something going on as far as allergies, and that one on the lip is all dry and gooey and yucky. So that's what I've got for you. There's a lot of things you can do topically to make those better, including apple cider vinegar rinse, so that's good. And then a couple of folks asking about rice, and May says, I know we're not supposed to use rice because it has poison in it. So May, here's the deal. I think that rice has been tested and other grains have not. And anything that uses water to grow is going to be contaminated with arsenic. Now, Jamie, interestingly, the brand that you posted, Lundberg, is, and actually May, you did as well, is the one brand that has tested their rice and has been able to show that they have no arsenic in it. The whole brown rice tends to have more arsenic than the white rice. So theoretically, that would be better to do that. Good. And it looks like Spirit loved the bone. And that's what I got. I hope that makes sense, y'all. Keep the questions coming. I'm not afraid to tackle them. And that's the thing, is it's just so difficult to kind of know what's right and what's not right, because there's so many people out there writing opinions that may or may not be based in fact. But the truth is that we don't have we don't have great answers, but I would use the NRC guidelines, and that's how I'm going to base reformulating the diet, the holistic total body support. And Penny, after the flare, just go low fat, adding it in. Yes, it's safe to add the liquid in, but you mentioned, yay, but you mentioned that she was having no episodes of urinary incontinence with London broil and rice and no Pro-N, which is awesome because I think Pro-N is actually creating a lot of Lola's issues. So I want you to add the veggies in more carefully. Now, here's in full disclosure, this is a great example of feeling your way through what's best for your dog. If my recommendations don't work for your dog, let's work together to adjust them. So Lola may be one of these dogs that simply doesn't need as much fiber. And for instance, my wife, Mary Jo, she can eat, cups and cups of veggies all day long, and I can eat about 3 cups of veggies a day, or my gut is like not happy and wakes me up at 3 o'clock in the morning to tell me about it. So go slow with it. And yeah, that's right. I can't remember how long. Anyway, we'll worry about that. So y'all, thanks for your patience and understanding. I will get these other documents posted up so you can have a look at them. But that's why you're so confused. And there's a ton of conflicting information out there. So until next week, remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally.